Hello, my name's Lee Howard, and I'm from Middletown, Ohio. You know, when you're in the midst of going through things that you're not quite sure what's going on, it's scary. And I had also, my twin sister had died in January of '09 from clear cell carcinoma of the uterus. So there was that in the back of my mind that I thought, oh my goodness, you know, what's going on here? And yeah, we need to go to the best in the country. They also let me know that they needed my medical records. So I made up this huge binder. It took quite like many hours to get this all together. And like I was saying, I can't imagine, you know, I have a nursing background, so it was easier for me to put it all together, but I would certainly feel sorry for the folks that have absolutely no medical background trying to put this together. I liked being able to put a picture up there with my family so that the physicians realize they're not just treating me, but they're getting me better so that I can go home and be a wife and a mother to my three sons that are here on this picture. So it was just kind of like it's a little bit about, you know, there's a inspirational card that's there, and there's my angels, and I flew with it. It was in my lap. It was just like, okay, here we go. This is, you know, this is what the docs are going to need to be able to figure out, you know, what we're going to do to get me better, and to have records to compare to whatever it is that they're going to do, and hopefully they don't have to repeat tests. When I first drove up to Mayo Clinic, I mean, I was having difficulty walking. I was nauseous. I was sick. I was scared beyond words, truly. And when my husband, you know, we pulled up into the big circle there, and there are gentlemen that would come out with the wheelchair to get you into the clinic. And that was just, it was just an incredible service. That my initial visit was with Dr. Lacey. She was in hematology, and she also had Dr. Syed with her. She was very happy that she had the binder, and she did take the time to look at all that information so that she could see what actually went on here in Middletown, Ohio. Well, in meeting with her with the back pain issues that I was having, she sent me on to Dr. James Dick, and he also took advantage of the medical records that were there. And then, long story short, what Mayo ended up finding out is that on a PET scan that we had done there, my spleen was hot. So it was a blessing that they found that out and that it was taken out. And ever since that occurred, I don't have any more nausea and I don't have any more pain. We have an information highway with the technology that we have today, and I think it's the next step. It's what we should be doing. With that binder, first of all, you can lose it. There's also with the binder that, what if I didn't get absolutely everything I needed in there with multiple doctors that I had seen? So if indeed the doctor can just go to my medical record and at his fingertips or her fingertips, there's my information. And there's no worries about, are they going to be able to see everything? They can look at all the medications that you're on. Are there going to be any drug interactions? There are things that by doing it electronically that you could actually save someone's life that way versus a paper, you know, paper and binder that, did I get everything? Could I lose that? So I think that emotionally they have too much on their plate to have to worry about putting together a binder. And, you know, and definitely with the older folks, and I think it's just going to be a whole lot easier. It's going to be easier for the patient, and it's going to be easier for the doctor to get the information that they need.